So within the new arrangements that start from April, it is extremely complicated. But at the heart of this are a series of key agreements at a national level which need to be played out and worked out at a local level. And at the heart of this is going to be the NHS Outcomes Framework, the mandate and the NHS Constitution. And the mandate's going to be published next week. So we will start to see what it looks like in a more granular sense at a national level about what it is that the Department of Health, Parliament and Ministers require of the NHS Commissioning Board as the public body that is responsible for, depends whose numbers you look at, but around £100 billion worth of public spend on healthcare services in England. That's going to highlight the importance of improving the patient experience. So that's a really key stake in the ground. And this concept that is really important for Secretary of State and for ministers about the quality of care being seen as important as the quality of treatment. Now, I know there are quite a lot of people that may not agree with the way in which that is described, that description of those two things as potentially separate but sitting alongside each other, whereas actually my view is that the reality of those is they are bound up intimately with each other. And also, even though we're starting to separate these different functions at a national level, the importance of joining them up at a local level between workforce sitting alongside the deliverables around the interface with the patient, the experience, and with the carer. So this is a personal interpretation about the Commissioning Board, but I think the Commissioning Board has four roles in the system. It has a role as a direct commissioner of services, so it will be the commissioner of a number of important services. So embedding improving patient and carer experience into that is absolutely crucial. The second role is about a much broader oversight of the commissioning system, recognising that the majority of the commissioning of healthcare services in this country will sit with clinical commissioning groups. The third one is as a key player across the system and as, in that sense, the holder of the NHS brand. And then fourthly, and potentially more controversially, this role as, on behalf of the public and patients, as an advocate. By this clear distinction between the provider system and the commissioning system, that enables the Commissioning Board to unequivocally ally its interests with patients and the public. So, this rather complicated slide is one that you may well have seen before because it was published as part of the white paper suite of documents that sets out the quality framework. And my concern is that we design this framework so that it is just as applicable to improving patient and carer experience as it is to improving mortality rates, as it is to improving the care for people with long-term conditions. And so we need to then build through, and the importance of the NICE quality standards, building that then into the outcomes framework, which is in effect the indicator set that applies at a local level about what good looks like. So this slide, although it's rather complicated, is absolutely crucial in understanding that national framework and how those things are going to play out. So I think there are three things that we're starting to prioritise at the Commissioning Board. Three things that are about putting experience at the heart of the agenda. The first one is about rapid feedback. The national survey shows that only 13% of hospital inpatients report being asked for their views. So it's appeared in the operating framework for the last 4 or 5 years. It isn't embedded in the way in which we do practice. The second issue is about working out what the added value role of commissioners are in this. And then thirdly, thinking about along the patient journey, how is that going to play out? And this has been an issue that's been discussed in many fora over many years now. But the way in which we've traditionally collected feedback has focused on individual organisations, and it's been driven by a desire for accountability of providers, rather than starting from a patient-centred perspective and say, what has your experience been across and between providers? The King's Fund and Nuffield Trust report to the Future Forum was very clear about what they thought the government should be doing. And that's about a clear ambition, measurable goal to improve the experience of patients and service users in relation to integrated care. So there are a series of methodological issues that I've just flagged up here. There are issues about feedback over a period of time. So if we're looking at a journey that takes and is part of an ongoing continuous process, we know that people, when they feed back about the experience they've had, that feedback does vary at the point at which you ask it. The second issue is about how do you get feedback from a number of different providers that are doing very different sorts of roles within a single methodological tool. And the third one, which I think is still a real issue, however much work Chris, who was chairing a session earlier on today, and Nuffield Trust and colleagues elsewhere have done about what great integrated care looks like, we still struggle with that. And the phrase itself, integrated care, is a problem in itself. So what we've got here is work that the Commissioning Board has done with National Voices, who've been absolutely instrumental in helping to think through what it means for the board about a phrase that tries to capture that. And so I think within the board, we're much more interested in a language that's about coordinated care, because that is much closer to people's experience. So I'm going to stop there. Hopefully what I've helped to give you is a national perspective and an initial look into the crystal ball about the thinking and work that's going on within the Commissioning Board, which of course as yet has not taken up its formal responsibilities apart for transition. Thank you very much.
Thank you, Richard.